Hello, my name is Amy Peterson and I am the nursery director here at Bethel Baptist Church, and I want to take this opportunity to share with you some things about our nurseries. And first of all, I want to thank you for your willingness to volunteer and be a nursery volunteer, because it's very important that our families and our little ones have a place to be on, during the services. Our families can attend the services and feel comfortable knowing that their young one is being cared for. And so as I share some things with you today, I just want to again thank you for your willingness, and ask for your grace and patience with me, as we're still in the COVID pandemic and there's a lot of things to navigate, but just appreciate your willingness to serve and your patience. So first I want to talk about just in the nursery. We are ministering to children. This is an extension of Bethel's ministry, and so this is a children's ministry. And so we're not just taking care of children and feeding them and changing their diapers and playing with them, but we really are ministering to them and hopefully teaching them about Jesus and about the good news, and starting them on a path that they're going to grow to love the Lord and to want to worship Him. So not only are we caring for children, but I want you to think of this as a ministry amongst ourselves. So as sisters in Christ, bringing along young ones, helping walk alongside each other to minister to each other as well. So taking the opportunity not only to minister to the children, but to other women that we're serving alongside. So as we know, it's just really important for little ones, when they are at this age, their brain is developing, and so there's lots of connections being made, and those are being made by their interactions with others and relationships that they build with their caregivers, their parents, their grandparents, siblings. So when we are with the children, we want to make sure that we're actively engaged with them, that we're talking to them, we're singing with them, we're using words that they're learning these things, even though they may not be able to talk back to us. We're teaching them words to say, and we're also modeling and helping them learn how to be how to have friends, and to be good friends to the other children that they're with. So how we handle situations is really important. So I really want you to be mindful of always using positive words and trying to stay away from negative words such as no and stop and don't, because little ones hear those words a lot, and so they often just kind of tune out the no. But if we describe what we want them to do, so for example, a little boy maybe just grabs a toy from another little boy, and instead of saying no, we don't do that, maybe we could just use the word, let's share. I'm just going to use I'm going to use my boy's name. So let's say Ben takes the toy from Sam. As a caregiver, I could say, okay, Sam was using that train, so we need to ask Sam if he's finished using it before we take it. And we're not only describing what we want that child to do, but we're also using the language and helping them build their language skills as well. So again, just keeping it very positive. I also want to talk about supervision, and we have implemented some new policies, or I guess confirmed some policies, and we've updated our policy handbook that we should have a copy in each room when you're there. That's still being finished, but it should be ready by the time you get into the nursery room, and can be sure to read that policy manual. But we want to make sure that we always have 2 adults in the room at each time, so each room. Right now we have the infant room open, and the 1 to 3 year old is combined. We do have the option to have 3 rooms if we have if the Lord blesses us with more children and we feel a need for safety to have those 3 different rooms. So even if we have a youth nursery worker in place on the schedule, we still want to have 2 adults in that room. And the youth nursery workers can be in the 1, 2, and 3-year-old rooms, but not in the infant room. So only individuals 18 and older can be in the infant room. And also we have moved to a female-only volunteer group. So in the past we have had some couples serve, but we're now just having ladies serve in the nursery, ladies and young women. So another thing to think about is when you come, when you get here, what are some things that we need to think about? So as a volunteer, we ask that you be here about 15 minutes prior to the service. So right now we're doing the main service at 10:30 on Sunday mornings. We're offering nursery during that time, so if you could be here by 10:15. And then we're asking families not to come before 10 minutes before. So that gives you just a few minutes to put your personal items away. And we ask that you put your purses, if you take off your shoes, we ask you to put all those things kind of up out of reach, ideally in one of the cubbies, just a place where little ones cannot reach them. And then wash your hands. And then just look around the room and make sure everything's kind of ready to start the morning. And make sure there's nothing that's unsafe, in the room. So you're all set and ready to go, and then the children are going to start to arrive. And we want to make sure that parents are signing in their child and providing a cell phone number where they could be reached during the service, where we could text them in case we needed to reach them in an emergency or if their child needed something. We do have pagers available. They are in the infant room, and if a parent does not have a cell phone that they can provide, we can provide them with a pager. But we are trying to go to the cell phones because we feel like more parents have those. Most would have those. So we want the parents to sign in their child and put their things away, but we also want them to wash their child's hands. So I think really ideally if they wash their child's hands first thing, that's good. Sign their child in. That way their child's ready to go play and their hands are all nice and clean. And then anything that they've brought for their child they can store away. And ideally we'd like for them to label any cups or a bottle that they bring with the child's name and the date. And I know that we only have sometimes 1 or 2 children right now, but in the event we had 5 children, it would be very easy to get things mixed up. So I think if we get our families and ourselves in the habit of implementing these new things, that it'll help just for future as our nursery grows. So we've got the children all settled in, we're settled in. I just want to address our sick policy. For those of you who've worked have volunteered in the past, there's not a lot of big changes. We do, but we have added that we are asking if anyone has any kind of signs of illness, or anyone in their home, any family members have signs of illness, that they just stay home and not bring any germs with them to church. That's going to help keep our volunteers, our young ones, and our church family all healthy. So we ask you as a volunteer, if you wake up that morning and don't feel well, just let me know, and we will make sure to cover, because we would rather, again, you be home taking care of yourself, feeling better, than to come and expose anybody. And then it's the same way with children. So just keep in mind, because sometimes we think maybe someone in our family, maybe they just have some allergies or sinus, but right now we can't know if it's COVID or not, so it's probably safest to stay home. Let's see. I'm going to go now to some safety things to keep in mind. In the infant room, we want, when we're, I know that we love our little ones and we like holding them and rocking them to sleep, and that's wonderful, and that's just the perfect thing to do. But if there's an infant that prefers to sleep in the crib, we do have 2 nice new cribs, and so we just want you to always remember to place infants on their back to sleep. So we don't ever want to put infants on their tummies or their side to sleep. And that's something that is a safe sleep guidance that is provided to parents before they have their baby in the hospital and then at the pediatrician's office. And hopefully that's what they're doing at home. There's a very high incidence. This is to prevent sudden infant death syndrome, which can happen in children 0 to 12 months old. And little ones, especially ages 2 to 4 months old, are at most risk. Also, the research shows that little boys are more at risk and that it's more likely to happen in the winter months. So there's a lot of safe sleep information out there that I'd be happy to share more with you about. But in our state, we do have a safe sleep program, and so that is where that guidance for families comes from. So infants are safest when they're on their back. Now, if you have an infant that can roll over on his or her own, and they can roll back and forth, and you want to put them on their back, but if they immediately flip over and get on their tummy on their own, that's okay, as long as they can get out of that position. So if we've got like a newborn who's 3 or 4 months old and they're just starting to roll over for the first time, and they can get one way, but they can't get back on their back, we want to put them back on their back until we make sure we've talked to the parents and they've let us know that they can safely do the back and forth. And if we're playing with them on the floor, we're probably going to be seeing that and getting to know them. Also, another safety thing for sleeping for infants is really the only thing that needs to be in the crib is the infant basically. So it's not recommended that there be any fluffy blankets, any soft toys. If the infant uses a pacifier, that's okay. But if they have a pacifier with one of those, it's like a little attachment piece that clips on, that can sometimes be a strangulation hazard. So really, it's best if it's just the baby and a pacifier, no blankets. And generally, parents will layer infants' clothes, and we keep the nursery fairly comfortable. So that's another recommendation that we have. It's also good for babies to have tummy time to get to. So we have blankets we have some blankets that you can put on the floor and let the little ones be on their tummy. And they may or may not like it or not. It depends on how much they're used to it at home. But if you do put an infant on their tummy, the main thing I want to share is that we never want to leave them. We want to always be right there in arm's reach when we have an infant on their tummy. So we wouldn't want to put an infant on their tummy and step away and go across the room to do something, like maybe clean some toys or put some toys away. If we're going to have an infant on their tummy, we need to be right there in arm's reach so we can see them, and we can be right there in case we need to roll them back on their back. For our older children, so when they start eating, like little ones, if we're feeding them a bottle, we should be holding them. If they are starting to take some solid foods and we have them in a high chair, we want to make sure we're always in arm's reach. We're sitting right there beside them the whole time if they're starting to feed themselves, because they could get choked at any minute. So we want to make sure that we're there to make sure that they're not putting too much in their mouth and that they're being safe. And if for some reason we have to step away, they can be safely strapped into the high chair, but we could maybe just take that little cup of whatever they're eating, Cheerios or those little puff things. We're just going to take them out of reach as well, because we want to make sure that they're not able to eat and drink while we're not there beside them. Okay, so let's move on to keeping everything clean and sanitary. So some things we've talked about hand washing when you arrive and when the children arrive, but I want you to be thinking about hand washing is the number one way that we can prevent the spread of germs and communicable illness. And communicable illness is, that's a nurse term, a health care term that I guess I assume everyone knows. But that's really means that someone has a germ, has an illness and a germ, and they pass that germ to a healthy person who then becomes ill. So that germ gets passed from one person to another. And right now with COVID-19, it's mostly passed through the air and the respiratory droplets. But communicable diseases or germs can be passed from touching shared items and coughing, sneezing, wiping, the nose with our hand and then touching everything with our hands. And as we know, little ones explore and learn by putting things in their mouth. So going back to hand washing, I want us to start to practice more hand washing, as far as we really should be washing hands before we prepare snack and before children eat. They should wash their hands. Ideally, they would wash their hands after they eat because they're mostly going to be doing things with their fingers and their hands, and so they're putting it in their mouth and they're getting all those mouth germs on their hands, and then they're going and touching everything in the room. So ideally, we're washing children's hands before and after they eat, and we're washing our hands before we serve. We should be washing our hands after we help a child go to the bathroom, and definitely after we do diaper changes. And we want to make sure that little ones who are going to the bathroom are washing their hands after they go to the toilet. For our little newborns, that are basically dependent on everything for us to feed them and diaper them and everything. If you want to, you could wipe their hands off with ideally just a wet paper towel, because we don't know what chemicals are on those hand wipes, and so we don't want them sticking those hands in their mouths. So it's best just to use a wet paper towel. There are some posters posted near the hand washing sinks, so you can kind of see that's what child care facilities in North Carolina use and to teach the children and the steps they follow for good, adequate hand washing. And those are also mainly what CDC, the Centers for Disease Control, recommends for proper hand washing. We mentioned mouth toys. So if we see a little one putting a toy in their mouth, again, that is completely normal. That's a typical behavior. And so that wouldn't be a time when we say, no, we don't put that in our mouth. But instead, we could talk about that toy, and we could talk about what we're seeing, what color it is, and what does that do, and try to connect it to something in that child's life. Again, building those brain connections. But when they're finished with that mouth toy, then we're going to make note. And if we can, we're going to go ahead and take it out of circulation and put it in like a little dirty toys bin so that we can clean it for later. So again, we don't really want to interrupt that play, but we want to just be monitoring and noting when things go in a child's mouth so we can bring those out of circulation before another child picks it up. And as far as that, we collect those toys, and then at the end of the day, we can clean those before we put them out. And generally, I think right now we're just using hot soapy water to clean them, and then letting them dry really well is probably sufficient for right now. Because I hesitate to put any chemicals on toys that are then going to go back in a child's mouth. So we do have procedures for diapering and toileting if you're assisting a child. So we always want to make sure the door is open to the bathroom in the room, so that again, we want to just make sure we're not behind a closed door alone with the child. There's always another person there. And then just making sure that we, if a child is on a changing table, we never take our hand off the child. We always have a hand on the child at all times. And ideally, these are kind of the steps we'd follow. We want to wash our hands, kind of gather our stuff together before we ever go pick up the child, so that when we get the child, we're ready to go. And so, removing the child's clothes, cleaning the child from front to back with a wipe. And each time you go from front to back, you want to use a new wipe, because we don't want to go back to the front with a contaminated wipe. And discarding the dirty diaper and the wipes. And then in childcare, they're required to actually do a hand wipe step. I'm not going to require you to do that, but if your hands get really soiled, so we do have gloves that you can wear, and it's probably best practice to wear gloves, especially if you're changing a child when a child's had a bowel movement. So we're going to get rid of those gloves after we've cleaned and gotten rid of the diaper. We're going to get rid of those gloves because they're contaminated now. And then with our ungloved hands, we can go ahead and put on a new diaper and dress the child. And then if the child's old enough to stand at the sink and get their hands washed, we want to help them wash their hands. If it's an infant, we can wipe their hands. And then we want to make sure we go back and clean the diapering table after the child's gone back to play, and then we'll wash our hands. I don't expect you to remember all this. It's going to all be written out in the nursery manual, the different steps, and I won't go into hand washing steps right now. The next thing I just want to talk about is emergency situations, and so we do have pagers for each room that we'll be sure that each room will have a pager that morning, and the person doing security at the front door, as well as Pastor Nick's down in the with the children's church, all have pagers. So in the event of emergency, you do have a way to call for assistance. That's one of the reasons why we want to always make sure we have at least 2 people in the room. And right now, as I know of, we don't have any children with allergies, but in the event we did have a child with an allergy, we'll be sure to make sure you feel comfortable. We'd make sure to have any allergies posted in each room, and make sure that we don't have anything that's unsafe for that child in that room. So if that were to come up, we will make sure to address that and provide any training that you need, and make sure that you're comfortable taking care of that child with an allergy. And as far as just kind of emergency response, that's something that we're working on, and we'll have some more guidance in our policy manual. But we are thinking about offering a CPR class, and if that's something that you're interested in, please let me know, because we would like to offer that at some point when it's safe to do so. And when we had a meeting in October, a lot of folks expressed an interest. So that's something that when it's safe to do with COVID, Pastor Nix has offered to make arrangements to maybe try to make that happen. And also, as far as in an emergency, we've got the walkie-talkies, but also we'll try to always make sure I have my cell phone number written down, at the bottom of the sign-in sheet, so that you can have a way to always text me to. I was trying to think if there was anything else I wanted to say about emergency situations. I feel like if we did have a CPR training, we might have a day where we just talk more about those kind of things one-on-one. Just kind of thinking about if we needed to evacuate, how do we do that? If we had somebody in the building that was an intruder, where's the safest place to go? And also, if we had like a storm come through and we had to shelter in place, where's the safest place to be in the event there's a hurricane warning or a tornado warning during a service? So all those things, we will make sure that we have guidance kind of written down, and that's something that we could definitely address going forward. And then just wanted to address the schedule. I will try to have the schedule posted 2 weeks before the next month starts. So we are in January now. So by the middle of January, I hope to have the February schedule ready and posted, so that gives you enough time to look at the date that you're scheduled, and to hopefully, if you see a conflict, make a switch with another person. And if that doesn't work, you can always reach out to me and I can try to help find coverage. Also, if you have any special requests, if you know that you're going to be on vacation a particular day of the month, or you're going to be out, if you know you're going to be out and traveling on a particular Sunday ahead of time, you can let me know and I can always make adjustments. And what I'll try to do is kind of try to make it consistently, like if you're on the schedule on the second Sunday of the month, I'll try to kind of keep it that way so that you can kind of plan around that, and also so that you're not serving 2 times close, kind of back to back or anything like that. And we do try to only have folks scheduled 1 time a month, so that people can also go to the service, because we don't want to pull people away from the service any more than we have to. I also wanted to just talk about the schedules for the nursery rooms. So for the infant room, it's really just going to be infant led. So whatever the infant's needs are is how we're gonna schedule it. So, nap time, play time, is diapering time, feeding time is all going to be based on what the infants need. And then for the 1 to 3 year old room, we do kind of have, I have it in my head, but it will be in writing, kind of a sample schedule. Basically, we'll give time for folks to arrive, and we know that families might be running a little bit late, so it'll just kind of be free time and free play for the first 15 or 20 minutes, and then we can offer a snack. That way it's well before the service ends. It's early into the service, so it won't conflict with lunch, with family's lunch after. And then we do have a nice Bible story book that Pastor Nix and his family provided, that we've got available. It's got a bookmark in it, so you can know where we were last week, where we should start this week, to offer maybe a Bible story, and realizing that it's hard for little ones to sit, so they may want to walk around and be playing and exploring but we're still teaching and learning a story that day. And again, trying to incorporate anything we can throughout the whole time we're together. And then following that, more play, maybe a chance to go to the bathroom or do a diaper change, and then kind of coinciding with the children's church going to the gym, there could be an opportunity to go to the gym, and we can have some materials, some play things pulled out for them to have about 15 minutes to go play. It gets them out of the room and move. It kind of breaks it up, and then allowing time to come back and have some more play. If we didn't get diapers changed before, or if a child needs to go to the potty, we can do all that well before the parents come pick up. So that we'll try to have all that posted. I think that's all that I have on my notes for today. I want you to feel comfortable to reach out to me, call me, or text me, or email me if you ever have any questions, you ever have any problems or concerns. And I look forward to serving alongside you, and I really appreciate you, and I just I can't thank you enough. So please come to me if you need anything, and I'll close with that. Thank you so much.